So research shows that having a mentor can increase the chance of success for underrepresented minorities in medical fields by 30%. So how do you approach mentoring, Black women medical students and guide them in this path and this journey that you've taken as well?
My experience has been a little bit different to where I had immediate family members that had gone through the process. My parents were both doctors, but I understand that this is not the case for many people. Only 5% of doctors in the US are Black. 2.5% women, 2.5% men. That's a pretty low number. When you ask yourself why, it's not because we're not smart and it's not because we can't make it to medical school. I think it's because.
Hey everyone, welcome once again to Medical Practice Success Secrets. I'm your host, Theo Harvey, and I'm super excited for my guest today, Dr. Eva Beaulieu. She is an award-winning entrepreneur, medical practice doctor, who's really focuses on inspiring women to live their best life by taking care of their bodies inside out. She was born and raised in Haiti, and Dr. Eva is a legacy in the making. She completed her internal medicine residency at the Medical Center of Central Georgia in 2011, and she's also a wife, mom of three, social media influencer, coach, and an author. She published her first book, Paging Dr. U, in 2020 and recently published her children's book, Tell Me Where Does It Hurt, in 2021. Dr. Eva, how are you today?
I'm great. Thank you so much for having me.
Thank you for joining today. I appreciate it. We love some of the things that you're doing out there in social media. One of the things that my audience is interested in is just some of the things that are happening currently in helping patients understand and navigate the health disparities right now. According to the CDC, Black Americans are 60% more likely to have diabetes than their white counterparts. What strategies have you implemented to improve outcomes for underserved communities?
Well, I think that a lot of practices can change the way they do things in order to be more welcoming to other cultures and other patients of other backgrounds. You have to train your doctors, your providers, your medical staff, your medical professionals to be culturally sensitive to patients that come from different backgrounds, different cultures, different languages. Because if you can be culturally sensitive, you can kind of understand where they're coming from and what challenges that they have in their community, and then be a little bit more relatable to where those patients can open up to you and tell you exactly what their challenges are so that you can meet them where they are and you're able to help them. I think it starts with that first. Other things that clinics and practices can do is maybe get with community leaders to organize events where you can go to those small communities or those underserved areas and educate patients, because education is key. A lot of people are doing things the wrong way because they don't know. It's not their fault. They have not been educated on what they need to do, what they need to eat, what they need to not eat, how often they need to see a doctor. Things like that comes from educating patients. So I think those two things mainly can make a huge difference when it comes to serving patients from other communities, other backgrounds, especially underserved communities.
No, great answer. Definitely the awareness and working with community leaders is something extremely important. But the one thing that you highlighted was the cultural relevancy, like having language communication styles. Our solution, we kind of help doctors with that when we do some of our outreach with monitoring patients at home and caring for them at home. You're right. Speaking to Mandarin, speaking to patients from Indian or Hindi background, Spanish speaking patients is really important to kind of build that trust up with patients. And not only just speaking a language, but understanding what healthcare means to each kind of culture is relatively important. So as someone who, grew up in Haiti and is now practicing here in the United States, do you see that all the time, the differences when you speak to patients of a Haitian descent as opposed to maybe African Americans or just general Americans? What are some of the differences and how are you kind of navigating those changes and how you speak to patients?
I think the fact that I am a Black woman in medicine is already something that has empowered me to want to relate to my patients, because going through this field and looking back now, I know a lot more now than I did back then when I was in residency and going through medical school. And some of the things that I had to endure back then which I thought were normal at the time, looking back now, were not normal. And so now it empowers me to even be more understanding of the person that is in front of me, and the fact that I'm from Haiti as well, and knowing that I had to come here and learn a new culture and learn a new language, and having to incorporate myself in the American way when we sometimes do things differently because of our culture, makes me even more understanding of patients that are coming from different places, because America could be a melting pot. And at the hospital, I see patients from all over the world. And so I want to be a little bit more understanding of their background, what they're going through, ultimately meet them where they are, to where they could feel comfortable to open up to me and feel comfortable to ask me questions, so that when they leave, they understand everything that's going on with them. Because it's very intimidating to come into an environment where you're sick and you're having to rely on somebody else and you don't know if you can trust them. Trust is very important in this field. And so when you lower your ego, and I have to say it that way, when you lower your ego and you understand that the person that's in front of you is human, just like you are human, then it makes the interaction a little bit better.
I love that. I spoke to several different doctors previously, and this one phrase came up, this the three T's of communicating with patients. You mentioned it, right? Being transparent, helping them see you as a human being, and relaying your story, your background that can kind of help put aside your ego as the expert to kind of connect with patients more. Obviously, building testimony, like what's your testimony of how you communicating that value to the patients and what you've seen happen before with other patients in similar backgrounds. And finally, building that trust, right? When you get through those first T's, you finally have that trust, and that patients can open up and feel more comfortable. Here in the United States, there have been a history of medical controversies dealing with African Americans, right? From the Tuskegee clinical trials to Henrietta Lacks, it's just low trust when it comes to medical fields. And so I think more doctors kind of came to it like you've come to it. I think we'll see more patients open up, and we'll see a shift in better quality care because patients are now feel more trustworthy of the system, if that makes sense. So when you kind of think about what your work now, obviously helping patients on a day-to-day basis, but I know mentorship is really important to you. And so research shows that having a mentor can increase the chance of success for underrepresented minorities in medical fields by 30%. So how do you approach mentoring, Black women medical students and guide them in this path and this journey that you've taken as well?
That's actually a very good question, because growing up myself, I was fortunate enough to have had multiple people in my family as doctors. My parents were both doctors. My mom's brother was a doctor. My dad's brother was a doctor. My grandpa was a doctor. So my experience has been a little bit different, to where I had immediate family members that had gone through the process that I could go to and ask questions and talk to them. And they really inspired me and mentored me and helped me out. But I understand that this is not the case for many people. As you can see, only 5% of doctors in the US are Black. 2.5% women, 2.5% men, approximately. So that's a pretty low number. And when you ask yourself why, it's not because we're not smart, and it's not because we can't make it to medical school. I think it's because the system is meant to fail us. And so I know that a lot of kids nowadays don't have that representation, and probably many of them have never seen a physician that looks like them. Mentoring women in this field, even men that want to go into medical school, is really important in increasing the diversity in that field, because you can provide guidance, you can provide support, you can provide inspiration, you can help them with imposter syndrome, you can help them feel like they belong right where they're supposed to be, and just knowing that they have someone that they can talk to and open up with and really ask any questions to helps tremendously.
Yeah, I had the opportunity to go to the National Medical Association in New York, which is the largest doctor Black run organization in the country. And I talked to a lot of doctors there, and they look at the younger generation. There is some discouragement. A lot of the younger generations like, do I really want to go down a path of being a doctor anymore, where there are probably a lot easier paths, maybe go down financial paths or be a social media influencer. So what would you say, to the younger generation that has affinity for science and math, but more importantly, has a heart to help people in this field, but they may feel overwhelmed about the path in front of them, like this next 8 years of school. What have you kind of mentored young folks on when it comes to understanding this journey and how to encourage them to stay on the path?
I think a lot of it stems from, again, not having the representation. It's really hard for you to see yourself being something that you've never seen in real life. When you turn on the TV, you see a lot of athletes, you see a lot of ball players, you see a lot of rappers. Not that there's anything wrong with that, but this is what you see. And you don't really see a lot of Black lawyers. You don't really see a lot of Black doctors, especially on TV. And so growing up, kids don't really have that representation, which means they never really think it's possible to reach. And so I want to help by providing an example, letting them know, look at me. I've done it. I'm living my life. I'm still able to help people follow my dreams and my passions while at the same time having a life outside of this career. Because another thing, too, is there's a misconception out there that once you go to medical school, you're not going to be able to have a family. You're not going to be able to be a mother. You're not married if that's what you want to do. You're just not going to have a life outside of medicine, period. And I want to tell everyone that this is not true at all. And so at the end of the day, the time is going to pass. You might as well follow your heart and follow your dreams, because 10 years from now, you're going to look back and be in a position where you're still not going to be fulfilled. And so if medicine is what you want to do, go ahead and pursue that, especially since, like I said, the time is going to pass anyway. So you might as well do something that you want to do.
That's a good analogy. I always tell my kids that as well. I said, look, the time 10 years is going to pass anyway. So you might as well start this journey. Yes, you're not going to be good at whatever skill you're trying to develop or path you're going on initially, but do a little bit every day, improve 5% every day. And you'll see yourself, wow, I've grown so much. Because I think sometimes we overestimate what can be done in a year, but we underestimate what can be done in 10 years. It's just, we don't believe how far we can go in 10 years, right? Because we just can't picture that. But sometimes, oh yeah, in a year, I'm going to get this done. I'm going to be at this level. But sometimes you may not get to that point. But 10 years from now is a long time. And to your point, that's going to pass anyway. So go down the path that you see that's popular or that's in your heart and you feel like you're called to become. And I think that's a great analogy. So you kind of look at your background, right? Obviously, coming from a family of doctors and kind of get into medical field. Any of your family members are on social media or writing books. So what made you kind of put yourself out there more, right? To kind of communicate. Obviously, we talk to a lot of doctors, nurse practitioners who yearn to kind of put their expertise out there, but maybe they're afraid, maybe they don't know where to start. What was your impetus to get started and what's keeping you moving forward and still putting yourself out there day in, day out?
So, really, I started social media as a way to inspire myself. A lot of people write in a journal and they look back. I really started putting positive things out there for me to go back and look at and inspire myself. And I got a pretty good response with inspiring other people as well. And so that kind of motivated me to keep going on social media, really to inspire others while I was also inspiring myself. Because if you look at my page, it's really positive, it's really inspiring, it's really educational. It's all the positives, not really a lot of negative. And social media in the healthcare field is still fairly new in a way. A lot of people don't know how to navigate that world. You're not taught in medical school or in residency how to navigate social media. Doctors just don't know how to deal with social media and what they can and cannot do, because it's a fine line between breaking the rules and the HIPAA law and all that kind of stuff, and the way that the public look at the medical professionals in a way. So you kind of have to still, what's the word I'm looking for? Like, you still, whatever you do on social media, you still have to portray a level of professionalism, if that makes sense. And so it's a really fine line, and a lot of people don't know how to navigate that world. Yet, social media is very important. You can't do anything without social media nowadays. If you have a practice that you need to promote, you need social media. If you want patients to come to you, you need social media. If you want to do anything now, you need social media. So it is a very important space, and it is a space that is only going to get bigger and bigger and grow more and more, and you cannot avoid it. And so I tell everyone and anyone in the medical field, in the medical space, that you really need to get yourself familiar with that space, because it's not going anywhere.
This is something we're seeing more and more doctors jump into. I think what was the big impetus was obviously COVID, right? We saw a
Right.
lot of doctors showing their expertise because what was happening, you saw a lot of folks who were not doctors and so-called experts giving their opinions, and it wasn't backed by science, it wasn't backed by anything, and there's a lot of misinformation going out there. And so we want to highlight on this channel individuals who are experts and can speak from authority and have a background to kind of speak with confidence of what can help patients. So for instance, one of my episodes, I had the virtual nephrologist, and he talked about a simple video he put on TikTok on how to breathe better if you're feeling like your anxiety. And that went viral. He got 1 million views off of that during the pandemic. And that helped countless people through certain areas and situations that they were dealing with. And so to your point, I think the way to look at it, if I'm always scared to do something too, it's like, okay, but who can I help? And then you focus on that piece of it, which I think that's what you're doing, right? Focus on who can I help by putting my story out there, being more in front. Yes, I might get some quote unquote haters or people who may not believe what I say, but I think the people who you help far outweighs that, right? And now we'll probably respond and say thank you for your inspiration over time. And so I guess I'm assuming that's what drives you to kind of continue to do this. Is that correct?
Correct. I mean, it's a combination of things. You know, you need to go out there, inspire others, show people what it's like to be in this field so that hopefully 20 years from now, there's more diversity in this field. You also want to combat misinformation. We do have a duty and a responsibility to make sure that whatever we do is a credible source, credible information that you're putting out there. And then also educate folks. A lot of it stems down to education, you know, educating your audience, helping them know things that will also empower them as well.
Yeah, for instance, I don't know if you know who Dr. Mike is, but he's a big time influencer on social media. And he did a post commenting on this new lunch offering for kids by from some influencers like Mr. Beast. You know, he was nuanced with it, but he was talking from a medical professional standpoint. And I think a lot of people didn't understand that, and they were trying to use that, build up their own influence. But he was very on point. He was from a scientific background. You mentioned when you started social media, still come from a professional standpoint, you know, with your expertise. But I think that was something that even he realized, and he's got 2 million followers. It's like, wow, there's certain things you have to be careful of when it comes to communicating on social media. And so I agree. I would encourage every doctor just to get started and show your expertise, because you'll be surprised at how many people you can help over time, and don't be concerned about that. And to your point also, with the doctors we talk to, a lot of them own their own practices. This is the way you get people to know who you are, right? They have to know you first. They have to get to like you, right? And then
Yeah,
they trust
trust
you.
you. Mhm.
No, like, trust, right? And so, and the way they do that is by seeing you consistently giving your expertise, providing value. If I'm listening to Dr. Eva and she's giving value every time I listen to her, wow, this is free. What if I go see her for, in real life, to get the support that I need from her? And so I think that is something very important. But yeah, so when you kind of look at the future, kind of where you're going with your practice and social media, where do you see yourself doing the next 5, 10 years and building out? It's not like an interview or anything like that, but I'd be curious. You're kind of still early in your career, but building it out pretty dramatically in the last 10 years. What do you see yourself? Obviously, you have a passion for influencing the next generation. You building books. What things are you working on now that you're really inspired by?
I'm really taking it a day at a time. I do it because I have a lot of fun with it. That's why it's not hard for me to do, because I get a lot of questions like, when do you find the time? How do you get to do all this? I mean, when you love what you do, it comes naturally, it comes easily, and it's a lot of fun. So that's exactly what I'm doing right now. Ultimately, the goal is to make sure that I inspire the youth and that we gather more and more people in this field. I would love my kids to be able to have doctors that look like them, because that makes a huge difference when it comes to patients being compliant, patients continuing to come back to you, patients taking their health seriously. If they trust you and they know that you care for them and you're listening to them and that you understand them, they will continue to come back and they will really take it serious. So all of that makes a huge difference when it comes to helping our communities. And so ultimately my goal is to help more people in this field, to let them know it's accessible and it's doable.
I love it. Great passion. Where can everyone find you where you give out this great inspirational insight and advice? Are you speaking somewhere anytime soon? Please let us know.
Um, I don't know about speaking anywhere anytime soon. And if I do, I will be posting it on my socials, mainly on Instagram, which is at dr.evab. So Dr.Eva is where you'll see anything and everything I have going on.
Awesome. Well, everyone, please follow her. Get inspired, not just for yourself, but for the next generation. I'm sure a lot of doctors mentor next generation of doctors. Dr. Eva is someone you can definitely follow and find out more information. Well, everyone, I just want to thank you for your time today. Listen to our latest podcast. Please take some of this advice to heart as you try to build your practice for the next generation, but more importantly, as we all navigate the complexities of the next view of healthcare. Thank you for your time. Have a great one, Dr. Eva.
Thank you for having me. Thank you.